Hey, morning.
Hey, good morning. How are you?
Good. How's everything with you?
Excellent.
Good, good. Nice.
Okay, so today we're just going to have a conversation. Uh, the way that I've always believed speech therapy should be done is not the standard way of practice
Okay.
across the United States. So um, I usually like to get some responses from families who have experienced the therapy.
Yeah.
So to start, I'm going to ask you about your mom and what happened and
Yeah.
when.
Yep. Yeah. So she had a stroke this month, actually, 3 years ago. She had it while she was sleeping. We had taken her to the hospital where they, did all the evaluations on her and basically had her on watch for 5 days. She made it to the fifth day, then they had to do emergency surgery to remove, cranioplasty. Um, After that, she did a stint in rehab, had the cranial part added back on, and then she was kind of released back to rehab where she spent another week or two and then came home. So that's in a nutshell, like the quickest and fastest way of kind of what happened, and in terms of her health scare.
So what was her speech like?
Not good. Yeah, I mean, when she came home, she was probably at thank you, yes, I love you, and no, 4 words. And oftentimes, it was not always something you could rely on. So when you ask her a question, you might not have gotten the correct response, even if she was saying yes or no. So it was tough. But yeah, she was extremely limited to 4 words exactly when she came home from her entire rehab hospital stay.
And how about therapy? What was going on with speech therapy during that time?
It was not the best. The therapist did what they could, but I feel like she was kind of like, okay, if she didn't meet these hard deadlines, if she didn't meet these hard skills by a certain time, they kind of just was like, okay, she's not going to get there. Let's get her to workbooks and iPads kind of thing. And for me, when I saw that, I actually came across your book first before I came across your YouTube. Um, I took your book and applied some of the skills early on, and I immediately started seeing some results. And that's where I started to question, not necessarily the hospital or the rehab facilities practices, but rather if it was tailored to her. I didn't think it was tailored to her. When somebody has like profound speech issues, they need somebody who's dealt with that for a while and has the experience, and which is why I ultimately reached out to you because I knew that this stuff works and it worked so easily with just using the book that I knew that if she had something tailored to her and structured, that it would garnish better results than the conventional speech therapy she was getting at the hospital and rehab facility.
And how was her initial response to the therapy at the hospital? And
It was frustrating for her. More so because maybe she didn't understand why she was in the situation she was in, and then obviously not being able to say what she wanted was probably the most. And I'm sure that's pretty consensus amongst all people who have a stroke and have their speech area affected. But she was very it wasn't fun. It wasn't the way that you do therapy where you not only implement extreme learning, but you also implement extreme fun. And it's tough for it to be fun when you don't talk to the patient about things that they enjoy, right? Like learning about certain things that they've probably never spoken about is not engaging to the patient versus where Her eyes lit up when we talked about, her gardening. I remember in the early sessions, that was the one thing that she loved to speak about, and it made a huge difference. It's very interesting how that, just being engaged in conversation, especially something you like about the topic you like about, can garnish so many results.
Okay. Can you tell me a little bit about your job as a family member with mom?
Yeah, yeah. I mean, in the early stages, it was, we would do an hour of therapy speech and an hour of therapy on her arm. Her arm is also affected, but we would not do it on the days that she had therapy with a licensed therapist. Obviously, we didn't want to overload her. But for us, it was really about managing her medicine, managing her schedule, speaking to doctors, speaking to all the professionals that we had to do, and then still finding time to sneak in an hour's worth of therapy for speech and hand on days that she didn't see someone licensed. But what we did was really just ask a million and one questions, and that's pretty much my advice to everybody: is ask a million and one questions and ask if there's any homework. Right, like when you get home, think of like areas that she's good at and think of areas that she needs to practice on. And then when you're at home, just taking an hour out of the day every day and doing that, especially early on, like really early on, that probably garnished the most results for her. And I think that's something that we all implemented as a family early on, is really making it structured, almost like kind of like a school.
Okay. And can you tell us a little bit about your mom's where she was born and her native language?
Yeah, she was born in Kosovo. Her native language is Albanian. But she also spoke, she had working language of English. So she worked at a hospital herself, and she was conversational and was able to get by on what tasks needed to get done and all that kind of stuff, and have conversations with her coworkers. So yeah, those were her two languages that she had, but primarily Albanian, and that's what she spoke at home.
Were you concerned at all about uh, her language and how that would work with speech therapy?
Yeah, and in the beginning it was really tough because the therapists at the hospital and at the rehab facility were using English. As soon as I said to her, that they had she had working language abilities with English, they were like, okay, I guess we'll just do English. And it became apparent as she was recovering more and more from her stroke, that she preferred to speak in her primary language, which was Albanian, over English. And again, of course, she understands English, but it seems like, and this is very common with people who have strokes, is that they default back to their primary language, and that's what we're probably seeing with my mom. So it was super important to get a translator or get someone who is willing to be patient enough and have okay, this is what you say in Albanian, and then translate it back to her. So that's what we found with you, of course, was somebody who was able to take on this project, because it really was a project of here's what you need to say and here's how you should say it, and then let me know how she said it. So it was great when we found that, because she definitely needed that. And there's not, who knows how many Albanian speech language pathologists are out there. So it was good to have that in the arsenal.
Okay, good. Um, did anybody else in the family help your mom recover speech?
Yeah, my brother, he also does therapy with her and you. So yeah, he's been phenomenal. He's been, and we both have different approaches to it, of course, as well. I don't like to like, I know I don't like to like help her as much. My brother does like to help her a little bit more, but it's all for good intention, of course. I like to allow her the time and the quiet and the peace to see if she could get it. And then if she can't get it, I'd like her to ask me. the question on how to get it. Whereas, my brother will try to help more to sound it out and say it. So, but it all for good effort. Everything is for good effort.
Okay, very good. Um, so what were your speech therapy visits like?
Oh, they were tons of fun. Tons of fun because they were very engaging. That's the immediate difference that you notice when you do speech therapy with you, Mark, versus where you do with somebody else. You could instantly see the expertise and the years of experience when you do therapy with you. And that's not to put anyone else down that she's done therapy with, but I think when you've been in the field for such a long time, you've been able to kind of via trial and error, see what works and what doesn't work, and know how to approach it. And I think you knew how to approach it because she went from somebody who was frustrated to really looking forward to her visits. I mean, she gets the iPad ready. She's her water to the side ready 5 minutes before therapy starts, and is ready to have her therapy visit now. Whereas before she was like, I don't want to do it today. But yeah, no, she definitely is very engaged. Tons of laughter, tons of learning, and it's been great. She went from her 3 or 4 words, slowly progressed to 1 to 2 utterances, then to 3 to 4, and now she's having sentences, and even times she's having paragraphs as well when she speaks. So it's really really good and unassisted. So we do have still some more goals that we want to achieve with her, but it's been. I don't think if she went back to her rehab hospital with any of her therapists, they would believe how far she's gotten because I don't think that they saw that for her, but I knew with you that I saw that that was possible. So really kudos to you and hats off to you.
Okay. What were some of the challenges that you faced?
She had apraxia. Well, she still does have a very minor apraxia now, but apraxia of speech definitely made it way more difficult than um, somebody who may have the standard Broca's aphasia, because it was difficult to get some of those words out, difficult to get the sounds correctly. So it was like having to learn the alphabet all over again and then having to learn how to pronunciate all over again. So just getting her to talk in the very beginning, just to say anything, right, was probably the biggest challenge. Because we needed to work on that motor function of her being able to even string out some words. So that was very, very challenging, and luckily we were able to address that challenge very early on.
Okay, good. Um, what advice would you give other family members or spouses or therapists when dealing with a person who has apraxia or aphasia?
Not to delay any kind of medical help, to go and address the issue ASAP. Of course, people talk about there is some kind of what's the word or terminology I'm trying to say? Spontaneous recovery. Of course, that's with anybody with a head injury, but the way you maximize spontaneous recovery is by pairing it with therapy, pairing it with somebody who's been doing it for a long time and knows what they're talking about. So I would say jump on that very early, and additionally be involved and engaged as much as possible, ask questions, and also practice what you're doing at therapy, right? So if you're involved in the therapy sessions as well, that's number one. You need to be involved as a family member in the therapy sessions, so you could see. Otherwise, you're just kind of just going, on your own and not knowing what to say. But yeah, I would say definitely seek help very early on. You want to maximize that spontaneous recovery and the what's the word I'm trying to think of, where the brain has neuropathy, where the brain has makes those connections. You want to definitely maximize that as well. So for me, it's very important to for family members, if they're reading about this, is to seek help early, get engaged in the therapy sessions, and use what you learn from therapy at practice at home because you want to maximize neuroplasticity and you want to maximize spontaneous recovery. And those three are the best ways to do it. And of course, obviously, this comes with having, a great speech therapist. So, yeah.
One of the things that I'm continually amazed by when I've watched you and your brother work with her. Uh, I keep reminding you that if you ever want to get out of the work you're doing, if you ever
Yeah.
want to change professions, my goodness, the way you guys stimulate your mom with her speech and language, I'd put you up against almost any professional out there.
Yeah, it comes naturally once you've done I mean, it's like we've done over, I don't know how many hours you would say, three sessions a week, and we've done it for 3 years now. You almost become a speech therapist yourself. We have the clinical hours, right?
That's right.
Yeah, we definitely have, and that's not accounting for, the practice at home we would do after there on days that she didn't have therapy. So yeah, you get a lot of clinical hours, and you know what works, and you have the tools to what works, and you apply that on the days that she has off, and yeah, you become really good at it, and that's very key because once the camera shuts off via therapy um, the real practice happens in everyday speech. And I think you're big on that as well as, just having conversations about anything at any moment, at any time. I think I remember reading from your first book. And if you don't know how to go about it or how to correct it while you're having the conversations, then it makes it more difficult. But when you do have those tools, it really, really gets the results that you could never get without having those tools.
Mhm. Great, great. Um, what what advice would you give to other families if English is not their primary language and their loved one has um, uh, pretty much just their native language?
Yeah, I would say not to fret, not to be scared. There's a lot of anxiety when it comes to that, especially because, there isn't an abundance of speech therapists, and the chances are that there's somebody out there that speaks your language is even smaller. So getting scared about that is like, okay, well, we'll just do it our own and we'll figure it out on our own is not going to benefit the patient at all. My number one thing would be to find someone whose experience has a lot of years, and I know I keep saying this, and it keeps becoming kind of the theme of our interview here, but experience is with a speech therapist, the years of experience definitely is the highest thing you should hold because it's super important to their recovery. But then also there is outlets for you as well. Like we were able to find somebody experienced via you, but also somebody who is patient enough and understanding enough that you may not know the language, but there's this person still needs help. And the way we've done it was I tasked you with this early on. I said, "Hey, I really love you, but I have one issue is that she is favoring Albanian over English, and I wanted to stick with that because I was like, this is her strength, and I'm okay if she never speaks English again, right? Obviously, she's speaking it now again more, but for me, it was more important to attack what was early on successful and to hit it hard and hit it fast. And we were able to do that. And I would tell people you could find help for you, even if you don't think that the person speaks that language. And you could find it with Mark. Mark will be able to sit down with you, address your concerns, tell you how to conduct therapy, how to do the tests that you need to see where they are in their language abilities, and devise a plan on how to go. So you're never um, you'll never feel anxiety. You'll never feel that fear that you do originally when you realize like this person might not have the help that they need. After speaking with you, I realized, okay, there's not an Albanian therapist, but there's Mark who is willing to sit there, have a game plan, answer their questions throughout from beginning till end, and still does. And able to devise a plan and have monthly goals. I think the number one thing that I really like about you is every month you send where she was where she is and what the plan is for the next month. So you're never left in the dark. And then you could also figure out what you need to work on. But for me, the biggest thing I would say to those people that are trying to find therapy for somebody who doesn't speak the language is reach out to somebody who's experienced. You can't replace that, and that will make a huge difference. Because I'm sure you've conducted therapy where somebody might not be comfortable in English, and you were able to find a workaround. There's always a workaround. It's just finding somebody who's willing to work with you around that.
Great. Any final thoughts about your experience and just the whole?
Yeah, it's been one hell of a ride. You know, taking something that's so traumatic and so devastating early on, because it really goes from being able to speak to somebody fully just the day before to now not being even able to say hello is really, 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 and it hits you hard because it's so quick and so fast. There's no warning sign. There's often no, telling what the future is going to look like, right? Because everybody's speech recovery is different. So early on, it gets really, really nerve-wracking. But when you consult with professionals, you consult with people who have been doing this for a long time, your concerns are addressed at ease. And in the beginning, you're just like, okay, I'm not sure, how they could get there, but you're like, we have to do something ASAP. And that's the most important thing is I remember, and if there's anything I tell people all the time is always, always seek second opinions from people that have been doing this for a long time, people who understand what it is and have seen a lot of things, and also just trust your therapist. Find somebody you trust, rather. If and after speaking to somebody, you could find out that there is better modalities to speech therapy than packets and iPads. I mean, I was super against that. And I understand like the reason why people do that, but I really truly believe the best way to get somebody talking, and this is your motto, is to get them talking. It's just talk, right? iPads and packets are great, for whatever purpose they serve, but the best way to get somebody talking is to actually start moving their lips. So if you have to start as early as sounding and making sounds, that's what you have to do, and then it progresses to better and better. So for me, the process was something that started really, really scary. You don't know what's going to happen. You don't know what the results are going to be. It's just super uncertainty. But when you deal with somebody who's a professional like Mark, he eases all your concerns. You're able to sit there, enjoy, and have great therapy sessions, and then you get to start seeing, surely but slowly, the patient going from places you had no idea. Places. The way I could describe it is where she's at, where she was even, I don't know, 2 years ago, were dreams of mine. So we've surpassed where I thought that she might get at baseline. We surpassed that 2 years ago. So the fact that she's now, speaking in sentences and paragraphs sometimes, is beyond my wildest dreams and only achievable because we decided to get a second opinion. We decided to trust somebody who's an expert, and we decided to actually talk. And we decided to actually have engaging and fun conversations during therapy. And we decided to also implement that in everyday speech. So for me, that's what I would say was this whole experience was taking something, to bring it back altogether, was taking something was super scary, super uncertain, to getting to a very comfortable place where we couldn't even imagine this is where she would be, not because of what's going on, but you were just hopeful that she would achieve, just even saying 3 or 4 words. But we've surpassed that now for 2 years, and you're just like, you know what? When you look back at this experience, it would not have been possible if it wasn't for, of course, your efforts and your training and your ability to want to work with somebody who was a little bit more difficult because of the task of not speaking the language. And it all comes down to really what you've taught us. So definitely super thankful for meeting you and having these training sessions, because It's far exceeded any of our expectations, and she is loving the fact that she could call people and talk to people, and she even stops people at the street now and has conversations with them. So she is, and I'll say one more thing. I remember, she used to get these spam calls all the time, and she'd be like, "Should I answer?" And I'd be like, "Yes, answer it," because this is the best practice you can get. So yeah, for me, I would say, listen, you need to find some, if there's a family member, reading this or listening to this, I would say don't delay it. Seek help immediately. Immediately seek help, especially if you want to get that golden period of like, and of course, neuroplasticity and spontaneous recovery far extend the 1 year mark, far extend the 2 year mark, as we're finding with research and with practice. So I would say definitely at any point if you're thinking about speech therapy, that's the perfect time to reach out for questions and get a consultation about where the person is and how they could where they could get. So don't think, all right, I'm 2 years out, there's no benefit. Oh, of course there is. Don't think, this is super early. Let me see how they get after 3, 4 months. No, no, this is the perfect time. So if anybody's listening to this or reading this, I would say right this moment is the perfect time for you to reach out to Mark and see what could be done for your loved one.
Okay. There's one final point that I'd like to stress. Uh, you've really hit all of them as far as from a care person or a family member point of view. But as a therapy point of view or a speech pathologist point of view, you and your brother have been an exception.
Yeah.
Now, I've practiced speech pathology now 55 years, and I really don't want to admit that.
Okay.
Okay.
Yeah.
But I have to admit it. And in that time, I would say I could count on either one or two hands the number of family members who have been as committed as you have.
Yeah.
Now, I work with a lot of people, and I always get some that cancel. I'm not feeling good today, or but I'll tell you, with you and your brother, you kept to that schedule
Yeah.
like a bull. Um, you didn't let any fluff go by. If the therapy was 3 times a week, you were there and ready to rock and roll when your visit was ready. And that's another very, very important aspect of therapy, that you've got to have a loved one and a therapist who truly have the patient's best interests at hand and are willing to go far beyond what probably most people go through.
Right. Yeah, 100%. It really makes the difference when you have a therapist who has the patient's best interest. And with this, and with honestly, with anything in life, even if you're not suffering from a stroke, repetition is the name of the game. So why wouldn't it be for somebody who's had a stroke now? They always talk about, and the best way you get better at speech, the best way you get better at, your job or anything that you do is just practice, practice, practice. So it's super, super important to make every appointment, barring any kind of medical issue or whatever the case may have been. You should make every single appointment. You should be engaged at every single appointment because it's really what's important to the patient. The difference between missing 1 week, you can notice it right away. Even if you make it up at home, even if because there could be a modality or something that oftentimes when we do therapy with you, Mark, there's something that we pick up that works and that like almost like put a light bulb in her head. And I'm just like, okay, now we're going to practice that this weekend. And if you miss your therapy, you might miss that opportunity of learning something where they could now open or unlock a new pathway to speech recovery versus where you miss this week's visit. Now you have to pick it up for what you lost, right? What you missed, and you not only did you miss the therapy session, but you missed potentially a new pathway of unlocking more speech recovery because of it. So it's super, super important to make every single therapy session because that's what's going to be the best for the patient is repetition, repetition, repetition.
All right. Well, this has been a real pleasure.
Yes, it has. Yeah.
And the relationship that we all have is very, very close and
Yeah.
very, very meaningful.
Yes, it is.
And that's what happens when you work with somebody for with the intensity that we did. So
Yeah.
like to thank you very
No,
much
thank you.
for,
It's been it's I don't think it would have been possible without you. I truly don't believe that. And it's been amazing because you are engaged in the patients, you have their best interest, and you really just want to talk about what they like rather than, whatever, and you tailor therapy to them. I think that's the most important thing. There is, of course, there's a procedure with anything, even with my job, my brother's job, there's always a way to go to it, but you need to be able to use proper judgment. You need to be able to sit there and say, okay, I know that this patient should be spending X amount of hours on this, but we feel comfortable that we can move on to the next thing. Or say, okay, they have not hit this goal. Let's readjust the plan and figure out what's the best way to move forward. And I think that was super helpful is getting tailored therapy. That is really, really what made a difference. So I really do want to thank you for that, for giving that tailored therapy to her. So
well, terrific. I'm gonna chat with your brother hopefully next
yeah,
week. And
yeah,
that way we can take a look at the way two family members
tea therapy. Yeah,
yeah.
yeah.
So thank you, Heather Nisi. This has
Thank
been
you
a
so much.
pleasure.
No, thank you.
Okay.
All right.
Bye bye now.